the deputy head of Finland. And I have a very title already of minister, so I will move the title of ambassador, and I really am an ambassador. I'm the political counselor and the trade counselor, and also security and media and cultural counselor. And so I deal with almost everything except visas in our embassy, which was reopened in 2022 in Pakistan. And now we have a staff of 6 people there, 4 Finns and 2 Pakistanis. So we are a small mission, but in the scale of my country, which only has 5 million people in total, it is a medium-sized mission that we have here in Pakistan. I'm not a health professional or psychology or even education professional, but just a career diplomat. So when Dr. Sana contacted us on this great initiative and work that they are doing for autistic children and youngsters, we suggested that maybe she would like to contact the Autism Foundation in Finland, because those people are the real experts in the field. And they did so. So they have already been in direct contact with Autism Foundation in Finland. And I think that some of the initiatives that we saw here have come out of this contact that already took place. So I am very happy to learn about this. I'm always happy when there are productive connections between our culture, because that's the job of diplomats in this world. It's especially good news because we are living in a kind of dark era with a lot of cruelty and cruel leaders, that somebody is doing something good for people and answering to the actual needs, like you expressed, that rather than pay attention on buildings, pay attention on the children instead, and their real needs. It's always good to have some kindness and care in the world. I'm also very much impressed of your presentation, because I have always been of the thought that nature is the best therapist. That's what I do when I feel depressed at the evil and cruelty of this world, that I go into the forest and I spend time, often alone, sometimes with somebody, but very often alone, just to be and the nature and the animals. And so I really believe that horses, not just horses, but dogs, parrots, cats, any kind of living creature next to you is very helpful. Horse might be more helpful than others, simply because it's very big. And like if you can control something so strong and fast, then you can do anything in your life. And I am sure that horse riding is a very empowering experience for lots of young people, especially those who have not had so much support from their normal social environment, because people with special needs tend to be somehow either looked down upon or fussed about life. In Finland, we are big believers of inclusion. So autism and ADHD and some of this kind of phenomena are a little bit vague for the very reason that not all the people who might fall into this spectrum ever get a diagnosis or even try to get a diagnosis, because a lot of them can survive with the normal society. But then, of course, many of them would benefit still from some answering their special needs. And then there is the group who definitely needs special care because they would not be able to cope with all the expectations and the life of the normal society. So in our school system, we try to include everyone, regardless of their background, their special needs, or so on, as a primary option with everybody else. But then some cannot. We have kids who don't know any Finnish language, so they will need some special care because of linguistic reasons. There are others who, for autism or some other reason, need special physical or psychological services. I'm also happy that your organization is doing everything at the same time. Awareness and advocacy, and also providing psychological services. I visited your other facility, the one that is outside of Islamabad, and now this is my first time visiting here. So congratulations for opening this facility, and congratulations for everybody here who is involved in it. So that's not me, but to them.
Yeah. I don't know if you have your personal experience dealing with such with several specialized people, like personal experience of your own life. Number one, and secondly, I want to know what is the difference between the organizations working over there in Finland and how you compare them with the organizations over here that are working in Pakistan. I want to know the difference. Please,
on my own experience, I know people who fall into the autism spectrum. They are not my family members, but they are friends, and they are very different from each other also. So this is one of the things that can show up in such diverse results. Some of them are more than capable of very good IT skills and so on, and then there are others who need it. But yeah. And I also know people who had serious psychological problems, some of them very close to me, and who needed also institutional care, but could be like bipolar disorder, which in the old times was called manic depressive disorder. And when a lot of people, including him, are saying that these things are in the increase globally, I think that this is probably one of the reasons.
Yeah. Yes.
And it's not making always our life. It's making our life easier, but sometimes too easy. And sometimes life makes our lives also harder. The differences between Finland and Pakistan, I am not sure if I can answer that question, because people here know the Pakistani system much better than me. I might know something about the Finnish system. I already described some of the tendencies. We have our official healthcare system, then we have the private sector, and actually a lot of people, they are using a hybrid model because they have subsidized healthcare from their employers, which is contracted then to private health services. And the fully public system is mainly used by pensioners, the biggest group, plus people, unemployed people and students. and foreigners. All of them can somehow cater to the problems of autism spectrum too. I don't know how well. You have talked to the Autism Foundation in Finland, so you might have heard from them what their opinion of the situation is. I trust our professionals. It's probably easier to get help in Finland than here, and I'm quite sure that the stigma is much less in Finland than here. Our system, not only healthcare, but the entire system, pays a lot of attention on privacy. So the threshold whether you should contact, for example, a psychologist is low because nobody else needs to know. You have to be on your own. But in the case of kids, the parents can do it with the kids, and their neighbors or teachers or bullies in the school don't need to know anything about it. That reduces the stigma significantly. It's just and you can be sure that in Finland, the doctor or the psychologist will not put it in Facebook or in WhatsApp after meeting a date. Here I'm sometimes shocked that the sense of privacy is very, very different. People post whatever totally private information. Or
that is why we do this that our clients, which we have, we always sign the consent page. That do you allow us to share the pictures or videos of the child for the research purpose or whatever we do here. Like for the awareness purpose, do you give the consent to say yes or no, and we
That is good. That is good. Well, in the case of children, I would be even more careful than that because sometimes parents and children might not agree on that.
But like you said, children. So children, they don't know. So if the parents say yes, so I should be more careful for the children as well. So I should do it for everyone then. I should not share.
I'm sorry, but I'm not your consultant.
I'm thinking about it. That, like our autistic children, they don't know that our videos are being, shown everywhere. So I should blur everybody's face. Because they don't know. Like my daughter, she don't like to show her, picture everywhere.
I think that she is very wise.
So I should not do it to everyone else. It's very good,
I would be very careful.
So thanks for that.
It's a very predatory world out there. It's often a question of also kind of cultural awareness. You have to explain things not only to the patient, but also those people who are around the patient, that they understand what is this. What is it, so they don't think that this is a person possessed by an evil spirit or something like that, but also for other reasons. Totally normal disabilities might be kind of weird and awkward for the people around these people, and they need to be informed.